Hello, I'm Harry Hobson, President and CEO of Plymouth Harbor, and I'm here again with my partner, Karen Novak, who is our infection control preventionist.
Very
How's that
good.
That, but she's also the administrator of our healthcare initiatives here at Plymouth Harbor. And we're here today to give you an update regarding several items, the COVID-19, of course, and then visitations. We'll be talking quite a bit about that here during this update, and then I'll touch on a couple of the major capital project I know that's on everybody's mind right now. So, Karen, I know that there is definitely an uptick in COVID-19 reported cases here in Sarasota County, state of Florida. And earlier today, I checked in with the hospital, and let me tell you what's happening there. I reported on a previous video that 2 weeks ago, there were a total of 8 COVID-19 cases in the hospital, 0 on ventilators, and 0 in intensive care. 1 week later, which was last week, that went from 8 to 23 COVID cases in the hospital, 4 on ventilators, and 5 in intensive care. As of this morning, that number has gone up again. The total has gone from 23 to 27, but probably more notable is ventilators have doubled. It's gone from 4 patients up to 8 patients on vents, and then intensive care unit has gone from 5 to 6. So there's no question that from those specific units, there is an uptick.
Absolutely, and even the hospital occupancy in and of itself has gone up. On Friday, it was at 51%, and now we're looking today at a 67% occupancy rate. And that's pretty significant, especially when you think about what's going on in the hospital. There's really not those elective surgeries that most people would really want to do because of the COVID going on right now.
Right.
We're seeing so much coming at us, and that little, I don't want to say second wave that we spoke about a while ago, this is still part of that first wave, and it's kind of come back with a vengeance. So time to really start acting upon it and know that we've got to take hold of this here at Plymouth Harbor.
There's no question. We said last week, I'll say it again, all you have to do is walk around the community, and many people are simply not following social distancing. And I think we're beginning to pay the price for that. I have to tell you, we were driving in on Interstate 75 late yesterday afternoon, and as you leave Georgia and approach the state line, everyone is funneled to 2 lines. The trucks go down 1 line, and then all the cars go down another line, and that's the checkpoint that they're doing. And as you approach then the official, he simply asked a question, where are you coming from? And they're listening for certain states, and then you're either given the go-ahead, which we were, or they will route you into more testing.
And Florida now is turning into that hot spot, that new epicenter, and I think it's got a lot of us here very, very concerned. I know that out of state, some of the mayors, governors are actually looking now at Floridians, whether or not they want the Floridians to actually be in their state at all. So times have turned, and not really good ones for here in the state of Florida.
Karen, as of right now, we're in good shape, although we've got some questions now that have cropped up. And you've had a very busy last 24 to 48 hours, and we want to share that with everyone here this morning. So why don't you share what's been going on, and then I'll get into visitations.
Sure. We've had something happen here in our backyard at one of the restaurants here on St. Armand Circle. One of their employees tested positive for COVID, and some of our residents have actually been to that restaurant and got exposed. That's a little concerning because, again, it's right there in our backyard, And then we had another resident that was at a different area that too got exposed. So we're seeing it out in the community, and that community then is coming into Plymouth Harbor. We also had one of our staff members test positive who was symptomatic. This is the first time at Plymouth Harbor that we've had somebody symptomatic. So we are testing everybody that was exposed to this particular person, monitoring them, and making sure that they are going to be okay and safe to be here while they're at Plymouth Harbor.
And you do that backtracking, so I know
We've done all those, the tracing, absolutely, and have identified those that have had any kind of contact with this person, and making sure that if we're not able to get to them today because they're off and maybe they had plans with family, that we want to get to them before they come back to work tomorrow morning.
Okay. And I want our residents to know that by the time you see this video at 4 o'clock later this afternoon, you will already have delivered to your mailboxes a special splash today. And I think the headline says it all. And basically what I'm saying is, effective immediately, Plymouth Harbor is closed to all visitors and guests. That's very, very important that we take that step now. So we gradually went from phase 2 back to phase 1, but we have to take it all the way back now, really for the health and well-being of our residents and our team members.
Absolutely, Harry. We've got to really break that chain of infection, and part of that chain of infection is the exposure. And to really reduce that risk, we've got to close off that visitation.
So no more guests or visitations here at Plymouth Harbor for the time being. I don't know how long. I'm guessing we'll come back and address it again in 2 to 3 weeks. So it's not just a day-by-day thing right now. And it's not simply not having guests here at Plymouth Harbor, but it's also the responsibility that our residents and our team members have as far as how to conduct themselves now. So what's your advice to residents, first of all?
You know, I think it's really important that you stay here at home at Plymouth Harbor. You know, the only time that really you should be going out is for medical appointments. Call, utilize the services that we have here at Plymouth Harbor. Get your groceries, bring them in. Let us take care of you that way. Please, most importantly, wear your masks at all time you're outside your apartment. We've had some issues with some of our residents being not quite so compliant. And again, that mask, you can help reduce that exposure risk almost down to less than 2%. I think it was 1.5 when 2 people have a mask on. That is so important that we get that risk exposure down. So please, wear your mask. Stay socially distanced. Maintain that 6 foot. And that's just not here at Plymouth Harbor. If you have to go out to a medical office, make sure that you're 6 foot from somebody. That too is essential in helping reduce that risk of exposure.
And you know, this flash that's going out is of course, it's intended for the residents, but our team members as well. And I have a message in here for all of our team members, and that is, please limit your greater community exposure when you're not here at Plymouth Harbor. And also, as Karen just said, please practice social distancing. Wear your mask at all times, except if you're within your workspace. And generally, those are the offices, the accounting offices, etc. When you're at your workstation, you have the option of pulling it off, but anytime you leave that area, you've got to put it right back on again. So please try to limit your exposure to the greater community. Now, regarding the contractors, I'm going to be asked a question. Certainly, I asked that myself earlier today, and that is, what are we going to do with the window project, the elevator project, and a couple of key apartment renovations going on right now? We are going to continue with those. They're both very, very important projects. We think we can control the access points regarding the contractors coming in. The window replacement project, which is all hurricane grade windows, very important. We're progressing nicely. We're going to continue to do that. And if you just take a look up here, not all of you can see this, But what I want to point out is, this is our new building, our Northwest Garden building. That is hurricane-proof, the windows, okay? And when I make references to the West Garden building, that's the building closest to the tower over here. That building will be totally buttoned up by the end of this week. And then we include the Energy Center. That will also be finished up within the next week. And then we'll be moving on to the East Garden apartments on our campus. We had hoped we could get North Garden started next, but the windows are still being manufactured right now, and we probably won't receive those on site for another month. And then we'll make the decision at that point, seeing how far we are with East Garden, whether we stop East Garden and then move to the north, because that's an important area which houses our skilled nursing facility, the Smith Care Center. We're moving forward with that project, and also the elevators, as I mentioned before, they're both very, very important. And because we're doing that, we're taking all of our contractors now, and they'll all be screened down through the East Garden entrance by the Safety Services Office. So they will not be coming at all through the lobby and basically crossing over with residents or other team members. So we feel good about that, and those are projects we really have to get finished.
And they should have very limited, if at all, interaction with our residents or team members.
Right, right. I think there'll be some interesting activity for those that like to watch construction and large equipment, because within the next few days, and we'll let you know when that's going to be, there's going to be quite a crane that will appear here at Plymouth Harbor as they move some heavy equipment into place. Our main building is 25 stories tall, so you can imagine the size of the crane that's going to be coming in to lift those materials up to the roof. So I'll keep you posted when that crane is due to arrive. The other thing that I want to be sure and talk about is the Wellness Center. We are progressing as planned with the opening of the Wellness Center. We've been very successful since June 15th with Phase 1. I just toured the area again this morning. I chatted with both Summer and Elizabeth. I know you're pleased.
Very, very happy. You know, the last thing that we want to do is see our residents become deconditioned because of that isolation. You know, it's so important. Our bodies were made to be upright and moving and exercising. We want to get everybody mobile and feeling really good, and not having that couch potato syndrome that kind of settles after a little while and makes people more prone to pneumonias. So get up and move and enjoy that wellness center. It's a good place to be.
So on one hand, while we're cutting back on visitations, okay, the good news is we're continuing to move forward with our wellness activities. Mm-hmm. So starting next week, June 29th, we will go into Phase 2 of our wellness program. And what does that mean? That means we are going to reopen the indoor therapy pool. I'm going to pause for a moment, as many residents are cheering right now.
I can hear them.
But we are going to reopen the indoor therapy and the indoor spa, and along with that, the fitness center. And I'm very convinced with Summer. I toured the area again this morning. They really do have their protocols in place to ensure everyone's safety. So that's the good news also. So we're going to be opening those areas more.
Good. I think we're going to find the outcomes are really great when people are moving and not just sitting.
Yeah, I agree. So I know we covered a lot in this short period of time. We gave you a COVID-19 update, and we're going to stay on that. We've got some test results we're going to be expecting soon. But because of that uptick in activities, we've made the decision we're going to have to close down for outside visitors and guests. We will move ahead with our two key projects with the elevators and the windows, and then also we've got a couple very important apartment renovations that are awaiting new residents that will be moving in, and And then the good news also on the Wellness Center, we'll continue to move forward with that. So that pretty much covers my list. Did you have anything else, Karen?
Yes, anytime the residents, if you'd like to have your testing done for COVID, if you feel you've been exposed to anything that makes you uncomfortable out in the community thus far, please come by the home care office and we'll be glad to get you tested. No better way to stay safe than to know what you're doing or where you're at.
Very good. I've said this 1,000 times, I'll say it again. I just so pleased that we have Karen Novak here as our Plymouth Harbor family. She really knows her stuff and has served as a guiding light to all of us. I also, in appreciation with some of the medical professionals that reside here at Plymouth Harbor, some nurses and some experienced physicians in infection control that also give us some guidance from time to time. We really appreciate that.
Absolutely.
So, Karen,
Okay, it's that time again. Please, again, if ever there's a time to remember that physical distancing, please, you are in charge of your gate. If someone is encroaching upon you, please ask them to stand at least 6 feet away. Team members, please stay home, stay safe, and then come to work proud to be a part of Plymouth Harbor. Remember, wash your hands. Every time you think about it, wash your hands. Hit those high contact areas. Remember to get your cell phones and your keys. Those two are carriers of organisms. But most importantly, we're going to ask you to don your mask. It's mandatory. Anytime you're outside your apartment, or team members, anytime you're out and about, or even in your work areas, please remember to don your masks. And I have to tell you a quick story, Harry, about donning. My daughter, Taylor, the one that came and gave us the talk, said, "Mom, you're the only person in the world that says don your mask. You have to tell people to wear your mask."
Ah.
Okay, wear your mask, per Taylor.
Okay.
So.
I just want to also thank all of our residents and the residents' families for their support.
Absolutely.
That's why we've been successful up to this point. We're going to have continued success because as we see some key indicators not going in the right direction, we're going to pull back. And that's all part of managing us through the end of this. And there is an end, and we'll get through this together and be successful.
Absolutely.
So, Karen, this brings the conclusion to this video, so therefore we shall wear our mask. Thank you.